Hello students, this is Instructor Shay. We are going to be doing a demo of what your practical exam is going to look like. So we're just going to run through that. It's going to be a little weird because my buddy here can't respond back, so I'm going to try and mimic him as best as I can for you guys. But we're going to do one for each, and just keep in mind that you're going to have to do this 2 times. So you'll see what you have to do individually and then double this up. So basically, as a reminder for what the kind of grading criteria is here, it's all based on a points-based rating system, so 0 to 4 per each numbered section, as kind of give you guys an example. The document that I sent you. So this is going to be per numbered section. So grading between 0 to 4 on introduction and identification, A through C, and then another 0 through 4 grade of number 2, A through C, etc., etc. 0 for the rating, kind of grading their description. 0 means failed, 1 is unsatisfactory, 2 means needs improvement, 3 is satisfactory, and 4 is excellent. The entire exam in itself is 80 points in total. You need at least 64 points or more to pass. 63 and under is going to unfortunately be a fail, but we're going to get you guys through this no problem. Some of the things that are going to be graded on is the introduction and identification. So introducing yourself and stating your purpose. So basically what that's going to look like is I'm going to walk up to my patient, right? Hi, my name is Shay. I'm going to be your phlebotomist today. We're needing to draw a couple of vials of blood. Can I please get your full name, your first and last name, as well as your date of birth? Patient's going to respond that their full name is Robert Thing Thornton. They were just born about 5 days ago, and so that would be whatever today's date is minus 5, and you guys can do that. I can't think of a date off the top of my head, but I'm going to confirm that that's the correct information that I have on my pretend requisition, and then I'm going to cleanse my hands and don my gloves. So we're going to pretend that that's also hand sanitizer because I don't have any. So we're sanitizing our hands, and then from here we're going to don our gloves. Next step, number 2, is patient preparation. So I'm going to be applying the tourniquet properly and at the appropriate location. He is not the easiest to tie a tourniquet on because of the fact that he has a rubber arm. So we're going to do our best to kind of mimic tourniquet tying here. So that's on him. And it is okay if you need to take this tourniquet off and reapply it. If you're having trouble locating a vein, just stay calm and do what you need to do. So we're going to palpate for which vein that we want to go into today. And if you're in a situation where you've had it on for a long time, just do what we practice. Take the tourniquet off, prep everything else, and then tie your tourniquet when you're prepared to move on. We're just going to leave that on him for all intents and purposes. Make sure that you're following the rules of keeping it on no more than 60 seconds or 1 minute. And then from here, we're going to make sure that we adequately clean the site. So part of that is going to be getting out our equipment. But for this one, it's just going to be accessing the alcohol, and we're prepping to make a proper antiseptic technique. And we're going to go in and cleanse down Robert here and get him all set up. And that'll go in the trash. We've selected our appropriate site. We've cleansed with the proper antiseptic technique. And we're also going to make sure that we're using correct timing by allowing that site to dry, which is where this would come in handy of having the tourniquet removed. We're just going to leave it on there since he's fake. And at this next step is going to be step number 3, which is equipment and supplies. So we're going to select based on the anatomy of Robert here and the vein preference. We're going to select the appropriate equipment, needle type. We need tubes for that, and we need gauze, etc. So we've got our straight needle, our hub. I'm going to grab more alcohol wipes just in case, as well as my gauze. And I know that for my straight needle, I need to draw 2 tubes of blood at 1 milliliter each. I'm going to actually grab one bigger and one smaller just for your guys' reference. And as another reminder, so for the straight needle, You're going to do 2 separate venipunctures. Both venipunctures with a straight needle need to be 2 tubes of blood, both at 1 milliliter each. So minimum. Next process, we've already gotten number 3. We're maintaining our sterile technique. We've got our equipment and supplies. We're also going to now be prepping that. This will obviously be happening a little bit faster than the way that I'm explaining it slowly. So we're allowing his site to dry. We're preparing our site here. We've got all of our equipment ready to go. We're also remembering that whatever your non-dominant hand is going to be the side that you're preparing the rest of your equipment. We're gonna prep our tape here, have that on my glove. And now since I am right-handed, all of my equipment that I need to access during the venipuncture is going to be readily available right here on the left side. Now, if you are a left-handed individual, you would want to flip that and have everything available. The reason being, we do not want to have to cross over to reach our equipment. We want clean access so that nothing is in the way and we have no possibility of bumping into Mr. Robert Thing Thornton here. So we are ready to do this. Site looks clean. So at this point, we're going into number 4, using or the venipuncture technique, which step 1 is using correct anchoring for the site. So as we know, that does not mean the C. I want my finger nowhere near where the top of the needle is going to be. And so I'm going to be going into this cubital vein here. So he's not very easy to anchor, but we're going to be anchoring the site as best as we can, well below where we're going to be performing the venipuncture. I want my thumbs out of the way, so I'll be anchoring further down and preparing that here. We're going to then insert the needle at the correct angle and speed for that specific chosen site. And we're also going to maintain a strong base, holding through the full draw. So keeping that anchor hand ready to go. And he doesn't bleed very well, so hopefully we can get a good one here. But let's see. 3, 2, 1. And we're going to also make sure that we're using our flanges to properly access that vein. Yeah, he doesn't like bleeding very well for me. I really want to get a good one though for you guys. But say we got our 1 milliliter of blood here. We got a little bit. We're going to need a little bit more. Actually, I don't know if I got it to him. And we'll get our 1 mil. And we got to grab our second one. So this is again with just the straight needle. We want to make sure that we are collecting 2 tubes at 1 milliliter each. It doesn't matter to me which tubes we last flow, which tubes is happening, just that you're collecting 2 of them and that they're each at 1 milliliter capacity. So he's not flowing. Hopefully we can get it with the butterfly. I can't figure out how to get his blood to actually flow well. Let's say we've got our 2 tubes of blood at 1 mil each. We're now going to make sure that we're ending the venipuncture, so releasing the tourniquet before that needle comes out, and that we're going to be removing the needle safely by preparing our gauze and hovering it, and remove safety pressure. And then this guy goes straight into the sharps container. And we're going to apply our pressure here. And we're next step is we're going to be into step 5, the post-draw protocol. So we obviously activated the needle safety and disposed of it in the sharps container. Our tubes were inverted during the venipuncture process. So if you have not done that, this would be a wonderful time to grab it and remember to invert. And then we are going to check our site, make sure Mr. Thornton here has stopped bleeding, and we're going to apply our bandage. We're going to also make sure that our patient is safe. We are going to then, we've got our tubes of blood, and we're going to make sure that we dispose of all materials correctly. So that means taking all of our stuff, if it hasn't been tossed yet, putting it into the trash can, and then removing our gloves and materials, etc. And that would be your first portion for a straight needle. And so we're going to do the same thing here for our patient going into the butterfly. We're going to introduce ourselves, do introductions as well, introducing myself and stating my purpose. I'm going to verify the patient name and date of birth. Yeah, sorry, my cat's in the background. And this is Robert Thing Thornton, birthday. We'll just use a random one, 4/12/62. And we're going to then cleanse our hands And we are going to don our gloves. And we are going to choose a site to draw from our patient, applying the tourniquet here as best we can again, in the appropriate location. There we go. Oh gosh. We've got Robert's tourniquet on here in the appropriate location per this draw. And we're going to select the site that we are wanting to utilize for his hand draw. I think I'm gonna go into this vein right here because there's a nice soft spot for me to enter into. I do like this though as well. So since that took me a minute to decide, I'm gonna take that tourniquet off. I'm gonna also work on getting Robert here aseptic, and so we're going to grab our alcohol wipe and we're going to prepare Robert's hand with nice continued friction. And there's that. And we're gonna prep the rest of our equipment. So we're gonna grab our single single tube for our butterfly venipuncture. Also gonna prepare our butterfly. We've got our gauze ready to go here, as well as our hub. And while that dries, I'm going to move into step 3, which was selecting and assembling all appropriate equipment using correct needle type, tube, gauze, etc. So we're going to set that down, and I'm going to prepare my tubing. I'm also going to make sure that everything is set up and ready to go here for Robert. This looks nice and straight. And same thing, I'm wanting to make sure that all of my equipment is set up on the non-dominant hand side for this draw. Robert's hand looks ready to go. So as we maintain sterile technique, we're going to move on to step 4, the venipuncture technique. So we're gonna reapply this tourniquet onto Robert and remove, that's driving me nuts. And then from here, we are going to get our needle prepped and make sure that we are inserting it at the correct angle and speed for the chosen site. One thing I almost forgot was my tape. And this is a perfect example of have I forgotten that prior to this process, I would have likely gotten maybe a point deducted. So maybe instead of a 4, I would have gotten a 3. As satisfactory, however, not excellent because I did forget something and moved on to step 4. So we're gonna have all our equipment prepared. So we're gonna make sure that I can identify Robert's vein again and which spot we were going into, because suddenly, there we go, right there. So we got Robert all set up here. And we're gonna go in on making sure my fingers are out of the way of my tubing. We can prep that beforehand if you like. And we're gonna go in on 3 as low. And remember also, you guys, you wanna make sure that you can see your window. So whether holding it this way or if holding this direction makes the most sense to you, totally okay by me. Just make sure that you're in good control of that needle the entire time through. So we're gonna go nice low angle, 3, 2, 1. And no flash yet, which is okay. We're gonna autocorrect by pulling back a bit. Oh, I felt it. Come on, little guy, just give me blood. There we go. So we're there. I'm gonna want you to keep this. Robert's very rubbery, so I have no issue letting him go. But we're gonna attach our needle. I'm not sure if you guys can see the tube flowing through. The blood color is really, really light. As you get more in there, you'll probably be able to see. Good, we got adequate blood flow this time. I don't know why I can't get that to happen with the straight needle. But we're going to make sure that we're collecting at least 1 milliliter of blood. This is where the 3 milliliter line is. I would say at this rate, with this particular tube, we're probably at the 1 milliliter. So if you were having trouble with it, you could always end the phlebotomy here. I'm going to attempt to pull everything, so I'm going to then remove his tourniquet, make sure this stays, and we're staying in nice control. And we're seeing when we're at capacity here, and I would say we're probably good. So I'm going to remove that tube, and I'm going to prep my gauze, hover, out, safety, pressure. And we're going to hold that there, and we know that our tube is securely locked in place because we've done that safety immediately after removing that needle. I got some blood in there. And then this guy is going to go straight into my sharps container. And there we have it. Post-drop protocol, the needle safety was activated. We disposed of it in the sharps in a properly, timely, and safe manner. We are inverting our tubes. We're ensuring that the patient is safe, they're not bleeding anymore, and we're disposing of all materials accordingly, and this is going to the lab. So at this too, we've met the requirement of at least 1 tube with 1 milliliter of blood was obtained, whereas with our straight needle venipuncture, we are making sure that we have at least 2 tubes with 1 milliliter of blood obtained. Okay, and then last but not least, this is just going to be done 2 more times. So once again with the straight needle and once again with the butterfly in the hand in another participant or volunteer or student or patient. Let me know if you guys have any questions with this, and hopefully that this was helpful for you guys to kind of see what that'll look like. We'll see you on practical exam day.